The third leading cause of death in the U.S. is stroke. Suffering a stroke is also a leading cause of serious long-term disability in the United States. Early diagnosis, treatment, and knowing the signs of a stroke are crucial, and that's the message we're hearing today from Dr. Meredith Maxwell, who joins us. First of all, let's talk about the couple different types of stroke.
Sure. There are two different types of stroke. There's ischemic, which is kind of like a blockage, and then there's hemorrhagic, which is actually a bleed. So those are the two different types, and they're treated very differently. So
I was going to save this for later, but I think it's a good opportunity. Oh, somebody's having a stroke. Let me give him an aspirin.
No, you don't want to do that because you don't know what kind of stroke it is. So this isn't like a heart attack. You want to call 911 immediately. Make sure you know, like, do your fast that we're going to learn today, and then, you know, get to the hospital and find out what type it is.
Okay, when you say fast, you're talking about the signs.
Exactly.
So let's go over this idea of FAST.
Exactly. This is a way that you can see if your loved one is having a stroke. So F is the facial asymmetry. Look at your loved one, get them to smile, see if there's a droop, right? You know, the second thing is arms. Get them to raise their arms. If there's a drift or they're not equal, that's a sign as well. Get them to repeat a sentence. That's a speech. Say, can you repeat this for me? If it's slurred, then that gives you a clue as well. And timing is so important with this. You need to document the time that they started having these symptoms, because that dictates if you can get clot-busting materials in the ER.
And these can vary, too, and I guess grow in their seriousness. You could have just a little bit of a slurred speech, or a little bit of a numbness or a laziness almost on one side that gets a lot worse, on your face, for example.
Exactly, and time is of the essence, so you really need to move fast on this. So call 911 as soon as you suspect something.
Is that it? Does that stop there? You just call 911 and kind of wait?
Well, you don't want to drive yourself, because that would be dangerous. So, and then you wait, and then the ambulance brings you to the nearest facility, and then they do kind of a scan and figure out which one it is, and then decide from there.
You think of a stroke patient, and you think, well, you could have a stroke or you could have a heart attack. They're kind of, but are the risk factors the same? Are they somewhat different? So
they are similar. So high cholesterol, smoking, cocaine use, amphetamine use, you know, high blood pressure is a really big one. So if you modify these risk factors, you can mitigate the risks of having them. But family history is also one. If you've had like a TIA or a transient episode, those can also really be big, you know, key factors.
Important message. Meredith Maxwell, thanks so much, Doctor, this morning.